your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome back. My next guest is Todd Martin, a nurse practitioner, a colleague of mine at Family Practice Associates. Welcome.
Thank you.
You told me you've been doing this a few years.
Just a few.
23
as a nurse practitioner, 33 as a nurse.
So you've given a lot of advice over that time. And so tonight we're going to talk about over-the-counter medicines and home remedies and when the symptoms that you're treating with might ought to see a doctor. So let's start quickly. Over-the-counter medicines for an upset stomach.
So upset stomach. So you've got the old Pepto-Bismol commercial that you can hear about, that, you know, the upset stomach diarrhea song that it always sticks in my brain. But so Pepto-Bismol is a good one. The one thing you always got to be cautious about is Pepto-Bismol, if you take a lot of it, can cause black stools, which can be a sign of GI bleeding. It's just kind of what that drug does. But some people get freaked out about it, so you always got to be cautious about that. You can take Dramamine, you can take Emeterol, all those. Emeterol is a sugar-based, I believe, and diabetics got to be cautious.
But if you've got bleeding, fever problems, then that's the time to go. That's not working, and you got to go see the doctor.
And you really, any of these things, you shouldn't take more than 72 hours before. If it's not stopping it, you should make an appointment and come see us.
How about diarrhea?
Diarrhea, Pepto-Bismol again. You can use that for diarrhea. You can use Imodium AD. Mylanta is good for diarrhea and upset stomach. Again, if it's not clearing up in 48, 72 hours, you should probably make an appointment, because there's certainly some infectious causes. We're seeing some norovirus right now that's causing a lot of nausea, vomiting, diarrhea. Sometimes you can get dehydrated really quick. Little kids especially, they get dehydrated really fast, so keep a good eye on them. A lot of over-the-counter products you can't use less than 2 years old. So you need to contact your pediatrician or family doctor.
All right. How about, let's go the other direction, constipation.
Constipation.
Something you can take for constipation.
Yeah, well, constipation's weird because it's essentially, everybody's different. Some people have a bowel movement every single day, sometimes twice a day. Some people go 4 days in between. So what's constipation for one person might not be constipation for another. But there are certainly some over-the-counter things you can try. Miralax is a good, safe, vegetable-based laxative that a lot of people use. The cap is a measuring cup, so you can put a cap full, dissolves in any liquid, water, coffee, tea. You can dissolve it in that and try that. Metamucil, Dulcolax are also things you can try. Again, 72 hours if it's not improving and you're miserable. And you also have to be wary of certain symptoms. Abdominal pain. Constipation to where you're vomiting can be a sign of a bowel obstruction. So listen to your body, watch for different signs. If it's not improving after 48, 72 hours, call your doctor.
And make sure your colonoscopy's current so nothing's up
Absolutely.
there. All right. How about heartburn, medicines for heartburn?
So heartburn, we got a whole variety of stuff. So there's Tums you can use, there's Mylanta, Prilosec, as a class of drugs called proton pump inhibitors. So Prilosec, Prevacid, the generic is omeprazole and lansoprazole, so you can certainly take those. The packaging says on those drugs, don't take more than 14 days. You can take them longer, but we want you to see your doctor, because also if you're having such heartburn, it can be a sign of other underlying causes. A lot of people confuse heartburn with heart attacks. So there's a lot of people who end up in the ER and they get, $3,000 bill, and you've got, indigestion, here's some, Mylanta, and off you go. But the symptoms are very similar. So sometimes you'll get an acid taste. So really, you want to treat yourself if you've got a established diagnosis of, acid reflux. Any kind of chest pain, you probably ought to be evaluated quicker for that.
Now let's talk about over-the-counter medications for sleep. We've got a sleep doctor coming up, but you can do some things other than sleep habits, medicine-wise.
Yeah, there's melatonin is a good one. It's safe. People take it all the time. Salmonex, Unisom. There's also one called Z-Quil, which has a little diphenhydramine. You can also take that, which is Benadryl, over-the-counter Benadryl.
Now you mentioned Benadryl, so real quickly, let's go ahead to medicines for cough and congestions, because Benadryl is used for allergies, can make you drowsy, but there's some other medicines for cough and congestion also.
Yeah. So Delsum is a good one. Robitussin is a good one. Again, some of them have decongestants in them. Some of them have expectorants in them. Some of them have dextromethorphan, which is a really good kind of cough suppressant. You got to be careful with some of them, though, with if you have high blood pressure, atrial fibrillation, those things, you really need to talk to your doctor about those.
It's great information. We appreciate you going over that with us. And the big thing is if you don't get better, the medicines don't help. Make sure you see your doctor. We'll be right back.